Hello and welcome. I want you to imagine for a moment that you're sitting across from me in my clinic, just the two of us, a comfortable chair, a cup of coffee if you'd like, and complete privacy. No judgment, no embarrassment, no topic off limits. I am an older woman. I am a doctor. I have spent decades treating men of all ages, from teenagers who are too shy to ask questions, to 80-year-old men who wish someone had told them these things 40 years ago. And today I am going to share with you the advice that 99% of men never hear. Not from their doctors, not from their fathers, not from their partners, and certainly not from the internet. This advice is life-changing. It could save your fertility. It could save your relationships. It could literally save your life. And I'm going to give it to you straight, because that is what you deserve. Let's start with the one thing that almost no one talks about. Male fertility. If I asked you right now what your sperm count is, you would probably laugh. Or look at me like I'm crazy. But here's the reality. Since 1973, global sperm counts have dropped by over 50%. This is not a theory. This is not speculation. This is peer-reviewed, published research from the journal Human Reproduction Update. The largest study ever conducted on the subject analyzed data from over 40,000 men across 53 countries. The conclusion was clear and alarming. The average man today has half the sperm count of his grandfather at the same age. Now think about what that means. If you are a 30-year-old man today, your fertility is likely significantly lower than your father's was at 30. And your father's was lower than his father's. We are on a downward trajectory, and most men have absolutely no idea. They assume that because they are men, fertility is guaranteed. They assume that infertility is a women's issue. But in roughly 40% of couples struggling to conceive, the primary or contributing factor is male factor infertility. Yet how many men get tested? Almost none. They send their wives for test after test, procedure after procedure, while never once having their own semen analyzed. That is not fair. That is not partnership. And that is not smart. So here is my first piece of life-changing advice. If you are in a relationship and you're trying to conceive, get tested. A semen analysis is simple, non-invasive, and relatively inexpensive. You can even do it at home now with mail-in kits. There is no excuse. Know your numbers. Know your count. Know your motility. Know your morphology. Do not assume. Do not let your ego get in the way of your future family. Now let me talk about something even more uncomfortable. Testicular cancer. This is the most common cancer in men between the ages of 15 and 35. Not lung cancer, not prostate cancer, testicular cancer. And yet I would bet that most young men have never been taught how to perform a testicular self-examination. We teach women about breast self-exams from the time they are teenagers.
But men?
Nothing. Complete silence. Here is what you need to know. Testicular cancer has a survival rate of over 95% when caught early. But that drops dramatically if it spreads. The difference between living a full, healthy life and becoming a statistic often comes down to one simple thing. A lump found early.
So let me teach you right now.
Once a month, after a warm shower when the skin is relaxed, gently roll each testicle between your thumb and fingers. Feel for any hard lumps, any changes in size, any swelling, any discomfort. If you find something, anything, do not wait. Do not be embarrassed. Go to a doctor immediately. The worst-case scenario of going to the doctor and having it be nothing is a moment of awkwardness. The worst-case scenario of not going is death. You do the math. Now, let's move to something that every man will face if he lives long enough. Prostate health. Your prostate is a walnut-sized gland that sits just below your bladder. You probably never think about it. But here is what happens. After age 50, that gland starts to enlarge. By age 60, 50% of men have benign prostatic hyperplasia, or BPH. By age 80, that number jumps to 90%. The symptoms are things that most men dismiss as just getting older. Getting up multiple times at night to urinate. A weak urine stream. Difficulty starting or stopping. Feeling like your bladder never fully empties. You tell yourself this is normal aging. It is not. It is treatable. And then there is prostate cancer. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. It is the second leading cause of cancer death among men in the United States. But here is the good news. When caught early, the 5-year survival rate is nearly 100%. The key is screening. The PSA blood test is controversial. I'll be honest about that. It can lead to false positives, unnecessary biopsies, and overtreatment of slow-growing cancers that might never have caused harm. But that conversation, that informed decision between you and your doctor, is one you need to have. Do not avoid it because you are afraid of the digital rectal exam. It takes 30 seconds. It could save your life. Your dignity is not worth more than your life. Now I want to talk about something that might make you uncomfortable, but I am going to say it anyway because it needs to be said. Erectile dysfunction. Almost every man will experience it at some point in his life. It is incredibly common, and yet it remains one of the most shame-filled, silent struggles that men face. Let me tell you what most men do not know. Erectile dysfunction is often not a sexual problem at all. It is a cardiovascular problem. The arteries in the penis are smaller than the arteries in your heart. So when plaque starts building up in your blood vessels, erectile dysfunction is often the very first warning sign, appearing years before a heart attack or stroke. If you're experiencing ED, especially if you are under 40, do not just order pills online. Do not just buy supplements from some sketchy website. Go to a doctor.
Get your heart checked. Get your cholesterol checked.
Get your blood pressure checked. Get your blood sugar checked. Erectile dysfunction can be an early warning sign of diabetes, of hypertension, of atherosclerosis. Your penis is trying to tell you something. Listen to it. And yes, there are psychological causes too. Stress, anxiety, depression, relationship problems, pornography addiction, performance pressure. But rule out the physical causes first. Because if your heart is struggling, no amount of Viagra is going to fix the underlying problem. It will just mask it while the real issue gets worse. Let me shift now to testosterone.
Low T.
You have seen the ads. Every podcast, every YouTube channel, every social media feed is pushing testosterone boosters, supplements, miracle cures. Let me be very clear. 99% of those products are complete garbage. They do not work. They are not regulated. They are taking your money and giving you nothing in return except maybe a placebo effect and expensive urine. Testosterone does decline with age. That is true. After age 30, it drops roughly 1% per year on average. That is natural. That is normal. But clinical hypogonadism, genuinely low testosterone, is a real medical condition that deserves real medical treatment. The symptoms include persistent fatigue, loss of muscle mass, increased body fat, reduced libido, erectile dysfunction, depression, brain fog, and decreased bone density. If you have these symptoms, get a blood test. A simple morning blood draw can tell you where your levels actually are, but do not self-medicate. Do not buy testosterone online. Do not take your friend's prescription. Unnecessary testosterone therapy increases your risk of blood clots, sleep apnea, and potentially prostate cancer. It can shrink your testicles and shut down your natural production, sometimes permanently. This is serious medicine. Treat it seriously. Now I want to spend some time on lifestyle factors because this is where the real power lies. What you do every single day has a massive impact on your reproductive health, and most men have no idea. Let's start with weight. Obesity reduces sperm quality, not by a little, but by up to 50%. Excess body fat produces estrogen, and elevated estrogen suppresses testosterone production. It is a vicious cycle. The heavier you are, the lower your testosterone. The lower your testosterone, the harder it is to lose weight. Breaking that cycle requires intention and often medical support. But the message is simple. If you want to protect your fertility and your hormonal health, maintain a healthy weight. Smoking. Cigarettes damage sperm DNA. They reduce count, they wreck motility, and they cause abnormal morphology. Every single cigarette is doing measurable damage to your future children. And I am not just talking about fertility. The children of smokers have higher rates of childhood cancer, of birth defects, of respiratory problems. If you are trying to conceive, quit. Not just for you, for them. Alcohol. Heavy drinking suppresses testosterone, damages the liver, and impairs sexual function. There's a reason they call it whiskey dick. But beyond the immediate effects, Chronic heavy drinking causes lasting damage to the hypothalamic pituitary gonadal axis, the hormonal system that controls your testosterone production. Moderation is fine. A glass of wine with dinner, a couple of beers with friends, probably no long-term harm. But if you're drinking heavily multiple times a week, you are directly sabotaging your hormonal health. Exercise is essential. But here's something interesting. Excessive cycling, I am talking hours and hours on a narrow saddle, can compress the perineal nerves and blood vessels, leading to numbness and erectile dysfunction. Competitive cyclists have higher rates of ED than the general population. The solution is not to stop cycling. It is to use a proper saddle, take breaks, stand up occasionally, and listen to your body. Moderation, always diet. Let me give you the short list of what actually matters for male reproductive health. Zinc, critical for sperm production and testosterone synthesis. You find it in oysters, beef, pumpkin seeds, lentils. Selenium, essential for sperm motility. Brazil nuts are the best source. Just 2 or 3 a day gives you everything you need.
Vitamin D, support testostérone production.
Get sunlight, eat fatty fish. Consider a supplement, especially in winter. Folate, protects sperm DNA integrity. Leafy greens, beans, avocado, asparagus. Antioxidants, protect against oxidative stress, which damages sperm. Berries, dark chocolate, walnuts, green tea, and water. Semen is mostly water. Chronic dehydration means lower semen volume and poor quality. Drink water. It is the simplest thing you can do. Now let me talk about something that I see destroying relationships. The pornography industrial complex. I am not anti-porn. I am not here to moralize. But I am a doctor, and I have to tell you what the evidence shows. Porn-induced erectile dysfunction is real. Young men in their 20s and 30s who cannot perform with a real partner but have no problem with pornography. This is a dopamine problem. Your brain gets so accustomed to the supernormal stimulus of endless novelty, high-definition videos, and instant gratification that a real human being, with real intimacy, real communication, real vulnerability, cannot compete. The solution is not shame. The solution is awareness. If this sounds like you, consider a digital detox.
Take a break.
Reset your dopamine receptors. Relearn what real intimacy feels like. And if you need help, seek it. There are therapists who specialize in exactly this. You are not broken. You are not alone. But you do need to take action. Let me talk about something that almost nobody discusses openly.
Performance anxiety.
So many men carry this silent burden. The pressure to perform. The fear of failure. The spiral where one bad experience leads to anxiety, which leads to more bad experiences, which leads to more anxiety. This is psychological, not physical. And it is incredibly common. The way out is communication. Talk to your partner. Tell them what you are feeling. Remove the pressure. Reframe sex as connection rather than performance. Take the focus off penetration. Explore other forms of intimacy. And if the problem persists, see a sex therapist. They have tools and techniques that work. You do not have to suffer in silence. Now I want to address something that ties into all of this. Mental health. Depression and anxiety have direct, measurable effects on reproductive health. Stress raises cortisol. Cortisol suppresses testosterone. Depression kills libido. Anxiety creates performance issues. And men are notoriously bad at seeking help for mental health. You have been taught from childhood to suppress your emotions. Boys don't cry. Man up. Tough it out. This is toxic. This is killing you. If you're struggling with your mental health, seek help. Talk to a therapist. Consider medication, if indicated. Talk to your partner, your friends, your family. You are not weak for having feelings. You are human. And addressing your mental health will improve every aspect of your life, including your reproductive health and your sex life. Let me shift to a topic that every man over 40 needs to hear. Aging and sexual function. Here is the myth. Getting older means your sex life is over. Here is the truth. I have patients in their 70s and 80s who have healthy, active, satisfying sex lives. The difference between them and the men who do not is not luck. It is lifelong maintenance, cardiovascular health, If your heart and blood vessels are healthy, erectile function is much more likely to remain intact. Mental health. If you have managed stress and maintained emotional well-being, your libido is much more likely to remain strong. Hormonal health. If you have monitored and managed your testosterone appropriately with medical supervision, your energy and drive are much more likely to persist. Relationship quality. If you have invested in your partnership, maintained communication, and nurtured intimacy, your sex life is much more likely to continue. The men who thrive sexually as they age are not the ones who took the most supplements. They are the ones who took care of their whole selves, body, mind, and relationships, consistently over decades. Start now, wherever you are. It is never too early, and it is never too late, and I want to talk about sexually transmitted infections for a moment. Because there is a dangerous myth that STIs are a young person's problem. They are not. In fact, STI rates among older adults have been rising significantly.
Why?
Because postmenopausal women cannot get pregnant, so couples stop using condoms without considering STIs. Because older adults are less likely to get tested. Because doctors are less likely to ask older patients about their sexual activity, chlamydia and gonorrhea can cause pelvic inflammatory disease in women and can contribute to male infertility. HPV causes genital warts and is linked to penile, anal, and throat cancers. HIV is now manageable but still life-changing.
Herpes is lifelong.
Syphilis is making a comeback. Get tested. Use protection. Have conversations with your partners. Your age does not make you immune. Now let me address the supplement industry directly because this genuinely makes me angry. Walk into any pharmacy or browse any online store and you will see rows and rows of products claiming to boost your testosterone, enhance your performance, increase your size, and restore your vitality. They have names that sound scientific. They have testimonials that sound convincing. They have price tags that suggest value. And almost all of them are worthless. The supplement industry in the United States is largely unregulated. Companies can make claims without proving them. They can sell products without demonstrating safety or efficacy. And they prey on your insecurities. They know you are worried about your virility. They know you want to perform better. They know you will pay almost anything for a solution. And they exploit that. Save your money. If you genuinely have a deficiency, vitamin D, zinc, magnesium, your doctor can identify it with a blood test and recommend a reputable supplement. Everything else is noise. Everything else is marketing. Everything else is someone getting rich off your fear. Now I want to talk about environmental factors that most people never consider. Endocrine disruptors. These are chemicals in our environment that interfere with our hormonal systems. BPA in plastics. Phthalates in personal care products. Pesticides on our food. Flame retardants in our furniture. These chemicals mimic estrogen in the body, block testosterone receptors, and disrupt the delicate hormonal balance that governs male reproductive health. What can you do? Do not microwave food in plastic containers. Use glass or stainless steel instead. Drink filtered water. Eat organic when possible, especially for the dirty dozen, the fruits and vegetables with the highest pesticide residues. Minimize processed and packaged foods. Choose fragrance-free personal care products when possible. These are small changes, but over a lifetime, their cumulative effect is significant. Heat exposure is another underappreciated factor. Your testicles are located outside your body for a reason. Sperm production requires a temperature slightly below core body temperature. That is basic biology. But modern life puts constant heat stress on this system. Laptops on your lap. The combination of heat and electromagnetic radiation is a double threat. Tight underwear that pulls everything close to the body. Long hot baths and saunas. Even prolonged sitting, especially in heated car seats. The solutions are simple. Use a laptop on a desk, not on your lap. Wear boxers instead of briefs if you are trying to conceive. Limit sauna and hot tub use. Take breaks from sitting. These are not dramatic interventions, but they can make a real difference, especially when combined with everything else we have discussed, that I want to speak directly to the younger men watching. Men in their 20s and early 30s. You are in your reproductive prime right now. This is the moment when you have the most control over your future fertility and your long-term health. The habits you build now will determine the trajectory of your health for the rest of your life. Do not take your fertility for granted. Just because you are young does not mean you are automatically fertile. Get a baseline sperm analysis. Even if you are not trying to conceive, know where you stand. Because if there is an issue, catching it now gives you options, lifestyle changes, medical treatment, sperm banking that you will not have if you wait until you are 40 and struggling to conceive. Do not ignore symptoms. That occasional testicular ache. That change in urination patterns. That decline in sexual function. These are not things to tough out. These are signals from your body that something needs attention. The earlier you address a problem, the easier it is to fix. And please educate yourself about your own body. Most men cannot accurately name the parts of their own reproductive anatomy. They do not know what the prostate does. They do not understand the ejaculatory process. They have never been taught. That is not entirely your fault. Our sex education system is broken. But you are an adult now, and the responsibility is yours. Read reputable sources. The Mayo Clinic, the NIH, the World Health Organization. Follow evidence-based health educators. Unfollow the quacks and the supplement pushers. Your health literacy is your power. The more you know, the better decisions you make. Now, let me speak to the men in relationships. This section is for you. Because your reproductive health does not exist in isolation. It is deeply intertwined with your partner's health, your shared goals, and the quality of your relationship. If your partner is going through menopause, educate yourself about it. Understand what she is experiencing, the hot flashes, the mood changes, the vaginal dryness, the shifts in libido. Do not take these changes personally.
Do not make them about you.
Support her. Go to doctor's appointments with her. Research treatment options together. Your empathy and understanding during this transition will strengthen your relationship in ways you cannot imagine. If you are trying to conceive, do not put all the burden on your partner. Do not assume that because you can have sex, you are fertile. Get tested early, before she goes through invasive procedures, before she takes medications with side effects, before she carries the emotional weight alone. Infertility is a couple's journey. Face it together from the start. If you are done having children, consider a vasectomy. It is safer, simpler, and has a faster recovery than female sterilization. It does not affect your testosterone. It does not affect your sexual function. It does not change your sensation. It simply prevents sperm from reaching your semen. And yet so many men refuse to even consider it, leaving their partners to undergo more invasive procedures or continue with hormonal contraception for decades. That is not partnership. That is selfishness. Let me talk about something that breaks my heart every time I see it in my clinic. Men who have been suffering silently for years because they were too embarrassed to ask for help. The man with testicular pain who convinced himself it was nothing until the cancer had spread. The man with erectile dysfunction who avoided intimacy with his wife for a decade rather than see a doctor, only to discover he had severe cardiovascular disease that could have been treated. The man with infertility who let his wife go through round after round of IVF without ever having his own sperm tested, only to find out the issue was a simple varicocele that could have been surgically corrected years earlier. These are not hypothetical. These are my patients. These are real men with real suffering that was largely preventable. And in every single case, the barrier was not access to care. It was not cost. It was shame. It was the belief that men should not talk about these things. That asking for help is a sign of weakness. Let me tell you what weakness really is. Weakness is knowing something is wrong and doing nothing about it because you are afraid of what people might think. Weakness is letting your ego make decisions that harm your health and hurt the people who love you. Weakness is choosing ignorance because knowledge might be uncomfortable. Strength is making the appointment. Strength is asking the awkward question. Strength is sitting in that doctor's office and saying, I have been having this problem and I need help. That is what real strength looks like. And the men who do that, those are the men who live longer, healthier, happier lives. That I want to close with a message about what it truly means to be a man. Our culture feeds you a toxic definition of masculinity that is narrow, rigid, and ultimately self-destructive. Be tough. Show no emotion. Never ask for help. Your worth is defined by your performance, in bed, at work, in the gym, with money. This definition is a trap. And it is literally killing you. True masculinity is not about suppressing your humanity. It is about embracing it fully. It is about having the courage to be vulnerable, the wisdom to seek knowledge, the humility to admit when you do not know something, the strength to ask for help when you need it, the integrity to take care of yourself so you can show up fully for the people who depend on you. Taking care of your reproductive health is not emasculating. It is the most masculine thing you can do, because it means you are taking responsibility. You are being proactive. You are protecting your future, your relationships, your family. You are breaking the cycle of silence and shame that has harmed generations of men before you. My name is Dr. Ava Brooks. I am an older woman. I am a physician. I have spent my career in the service of men's health. And I am telling you from the depths of my experience and the bottom of my heart, the things I have shared with you today can change your life. But only if you act on them. Do not just watch this video and move on. Make the appointment. Have the conversation.
Do the self-exam. Get the blood test.
Change the habit. Educate yourself. Talk to your partner. Break the silence. You deserve to live a full, healthy, vibrant life. You deserve satisfying relationships and rewarding intimacy. You deserve to understand your own body and to feel in control of your health. You deserve to age with dignity, strength, and vitality. But you have to claim it. No one is going to do it for you. Thank you for listening. Thank you for being here. Thank you for caring enough about yourself to watch until the end. If this video helped you, share it with the men in your life. Your father, your brother, your son, your best friend. The silence around men's reproductive health has gone on long enough. Be the one who breaks it. Take care of yourself. Take care of each other. I will see you in the next video.